I'm Dr. Dan Borison. I'm the founder and the president of Primus Wound Care. I spent 22 years being a surgeon. I did trauma surgery. I was chief of trauma for a while. I was chairman of the Department of Surgery. I wanted to set up a quality wound care company designed to allow physicians to practice and have a great lifestyle and a reasonable income and to love what they do. I think we all know what healthcare is like now as opposed to what it was like 20 or 30 years ago. But it used to be the doctor was the boss and he could do the best possible thing for his patients, and cost wasn't an issue, and there was no administrators telling him what to do. There was too many office people telling me what to do, telling me when I can get a new cell phone, how many patients I have to see per hour, what my notes have to look like, what the coding has to be. There was meetings all the time to go to. You know, there's a lot of changes that are good and a lot of quality control issues that help patient care. Who wants to see patients till 6 o'clock during the day, then return phone calls for another hour or two, then finish your charting? So now with what you used to have as a 5 or 6 o'clock end time, now you're finishing at 9 o'clock at night. And again, that doesn't help with your lifestyle, doesn't help you see your family, your kids. I know what it's like to be a doctor. I know the satisfaction of taking care of patients. I know the satisfaction of helping someone and healing them and talking to their family and reassuring them. But I also know the frustrations. And as a physician, I didn't like being ordered around and told what to do. I think we as physicians were trained to have some independence, respect for our thought process. At Primus, we give you the opportunity to do what you want to do, to be a physician, to work hard, to see patients, to enjoy the interactions and taking care of patients. Well, I think we offer a really unique experience for a doctor. It's kind of like the old days. We take care of patients, we interact with the patients, we interact with the families, we interact with the staff. And there's a lot of paperwork and there's charting and there's coding, but there's so much less of that. And we get to enjoy our lifestyle. We get to enjoy practicing medicine as we were trained to do. Primus has a lot of advantages. Well, I think the key is that there's no nights, there's no weekends, there's no holidays, and that is huge for any physician. During the day, you take care of patients, you look at charts, you write notes, you may talk to a family member occasionally, you interact with the nurses, and then you go home and you're done. You don't have to look over your notes at night. You don't have to answer patient calls at night. You don't have to answer emails at night. At night, you're on your own. The first weekend, I just did wound care and nothing else. I felt like I was on vacation because I was like a regular person. I could, be at home Saturday morning with my kids. I could go out for brunch Sunday. I didn't have to worry about making rounds, who's covering for me, none of that. And it was just amazing. Our schedule at Primus really depends on you as a physician. You can work full-time, which is 5 days a week. Again, no nights, no weekends, just Monday through Friday. You can work part-time. You need to work a minimum of 2 days a week in order to make things work. The typical day, I may start in a nursing home at 7 o'clock, and then I'm done by 2 or 3 o'clock most days. Other people want to do something else in the morning. They want to start about 8, and they start at 8 or 8:30 even, and then they're done by 3, 4 o'clock. I love working in nursing homes, and I never thought I would. For the most part, nursing homes are a little less budgeted than the hospitals that you may be used to in an acute care hospital, but the people are great. The people that work in nursing homes, they really want to work in nursing homes. They have this quality that they love elderly people, and they're really there for the patient and for the resident, and it's contagious. Much less stress than an acute care hospital where there's no competition. We just work together as a team. So what we do is go into the nursing home and we evaluate the patient, do a physical examination, take a history, take a look at the wounds, try and figure out what kind of wounds they are and what the appropriate treatment might be. We do some charting, but that stuff is really much, much less than in any kind of primary care office or in any kind of hospital. We have templates set up to help you do your notes, and in those templates you can actually see a patient, spend 10 or 15 minutes seeing a patient, and then spend only a minute or two doing the note. So for the most part, you see the patient and you're done. We really train our physicians well. Before we set someone loose into a nursing home, we make sure that they know what they're doing. There's a lot of nuances and a lot of specifics to wound care, but that can be learned. It's kind of like a residency program. We have a very extensive training where the physicians that join us, They will follow one of our own physicians around for quite a while, often me. But a lot of it is even hands-on and just training with me and the rest of our team and figuring out how we do things and how we do things differently than other people. And I think that any physician can be trained to do what we do. I'm happy to teach them everything. At Primus, we like to set a good salary. I want to make sure that physicians make a good amount of money for working a reasonable amount of time and having a good lifestyle. What you'll make at Primus Wound Care is more than you'll make as a primary care physician, and you'll probably work half the hours. You can make more money in a hospital being a neurosurgeon, but you're going to work 100 plus hours a week. And again, that's not what we're doing here at Primus. I get it. I was a physician for many years. It's still possible to be a physician, to enjoy what you do, and to enjoy your lifestyle when you're not working.